See me like this, I will just think I'm a footballer. I play football. I'm a judoka. When I told them that, I said I'm also a karateka. Yes, they say, how did you do it? Then I'll now tell them that what you thought that person with disability cannot do, they can do it.
This is Against All Odds.
You will agree with me that there are a lot of issues around persons with disability. But then, of course, there are some things that are very daring to talk about. Everything should be spoken about. But today, on Against All Odds, we will be bringing to your doorstep the issues of women, and children with disability. Women and children with disability, you will agree with me, that are one of the most vulnerable set of persons with disability. That is because it is not easy to be a woman. There are a lot of things associated with being a woman or being a child. And then a woman with disability or a child with disability is a big deal. And today on Against All Odds, we will be bringing to you issues around persons with disability, women and children, how we can help them so they will not be completely excluded from the society. What we're fighting towards is total inclusion for women and children with disability. Also, statistics is a big deal, because without statistics of persons with disability, we cannot know the exact number of persons with disability that needs to be catered for. And so on this episode, data collection is another thing we're bringing to you. Not leaving out the importance of COVID-19 vaccination. Yes, we all feel like COVID-19 is gone, but it's still here with us. And that is why we talk about COVID-19 intervention and all that, bearing in mind all that COVID-19 brought to our doorstep. The importance of COVID-19 vaccination, says Mr. James Lalu, National Commission for Persons with Disability. All this we will bring right to your doorstep this week on Against All Odds. And we urge you to stay with us. We will be back very shortly. My name is Dushima Pius Ikeravi.
This is Against All Odds.
Women and children with disabilities are among the most marginalized group in the society. If society continues to see the disability before it sees this set of persons, the risk of exclusion and discrimination remains. According to the World Health Organization, 15% of the global population lives with disabilities, making it the largest minority in the world, with children and women numbering higher among those disabled. Women and children with disabilities face systemic marginalization and are also attitudinal and environmental barriers that lead to lower economic and social status, increased risks of violence and abuse, sexual violence, discrimination, as well as harmful gender-based discriminatory practices, and barriers to access education, healthcare, including sexual and reproductive health, information and services, and justice, as well as civic and political participation. This hinders their participation on an annual basis with others. Representatives of non-governmental organizations, private companies got together to address the systemic discrimination that exists against persons with disabilities. This came to a fall at the National Commission for Persons with Disabilities Summit in Abuja. There is a strong consensus regarding the risks that both children and women face. Women with disabilities are especially vulnerable to discrimination and violence. 3 to 5 times more likely to suffer from violence and abuse than the average female population.
To articulate strategies for care and support of women and children with disabilities. In line with Sustainable Development Goals, which we call SDGs, there's need to mainstream disability in all efforts to achieve gender equality and women's empowerment, which is SDG Goal 5. Highlighting key issues for ending poverty, SDG 1, and ensuring healthy lives, SDG 3, for women and girls with disability, form the basis for today's strategic meeting. The meeting is aimed at evolving strategies on holistic care and support for women and children with disabilities in Nigeria. The objectives of this meeting include, among others, to develop realistic strategies on care and support for women and children with disabilities in Nigeria, to provide platform for the inclusion of women and girls with disabilities in development agenda, to strengthen capacities of civil societies organizations / NGOs working on women and girls with disabilities, to encourage and promote active involvement that will enable the ministry to track progress on social inclusion of women and children with disabilities. The ministry will continue with its concerted efforts towards addressing issues that relate to persons with disabilities in Nigeria in general.
They were at the forefront of pushing such that now disability issues are a human rights issues. And of course, you know that Nigeria recently signed the Disability Rights Bill into law. And now it is a crime to discriminate against a person with disability. So the concept of disability can be quite complicated, and there are different frameworks. So today we're going to use the framework of the International Classification of Functioning Disability and Health, the ICF. I like this framework because it's really simple, it's easy to understand, and it breaks disability into 3 core areas: impairment, limitation of activity, and participation restriction. So, impairment has to do with the alteration of body functions. But beyond that is the fact that this limitation of body function can be associated with limitation of activities, and then there might be limitation of access. So if, for instance, someone who has no limbs, right, that's an impairment. But in terms of execution of activities, this individual can swim, right? So the individual has the capacity to do a lot of activities. But then, does this individual have access to a swimming pool or to the recreational facilities that will enable him or her to access this activity? So our rationale for being here is to break the barriers and to facilitate social inclusion so that every woman and child with disability can have access to education, be empowered occupationally, have access to healthcare and rehabilitation services. Whatever services she needs, she should have access to them.
We must make humanitarian response inclusive in emergency situations. Children with disabilities face a double disadvantage. They face the same danger as all children in conflicts or natural disasters do.
We should have accessible communities. Women with disabilities should be carried along. We should be represented in leadership positions and decision-making positions. We should be among the person seated on the decision-making bodies. People shouldn't go and take decisions on our behalf. We wear the shoes and we know where it pinches us. If a decision is to be made, women with disabilities should be represented in person, not decisions shouldn't be made and communicated to us, because you might not understand. And we have different types of disability. We have people on the wheelchair, we have persons with albinism. These people have specific needs. So all these people should be brought together. I, as an amputee, shouldn't go on a decision-making body to go and take a decision on behalf of persons with albinism. I don't have albinism, and I don't know what those people feel, and I don't know their needs. So inclusion should be a key, and no one should be left behind. Disability is everybody's business.
In fact, who chooses your shoes for you? All those questions. When people ask you that kind of question, I myself in particular, I felt depressed. Because I can't imagine, like, although it's not easy, you are standing there, I can't see, you understand? Imagine yourself. I'm not saying that it's you, because I was once like you before. I'm saying, before suddenly you became blind, just reason what it will take. Like in our disability groups or disability community, it's different types. Different by difference. What I'm passing through might not be what another person is passing through.
To address this issue, we must increase investment in the development and production of assistive technologies. Assistive technologies such as hearing aids, wheelchairs, prosthetics, and glasses give children with disabilities the chance to see themselves as able from an early age.
Persons with disability. In this context, we are talking about women with disability, because it's not just good enough to just say that's a house, move in. Can I move into the house without needing somebody to assist me get there? So if there's something the government can do to assist women, we'll be giving them a reasonable housing, a house that they can access. Then another thing is this question I want to ask Ave. How would she feel, for instance, if she is a person with disability as she is, and then she's on wheelchair? Because inviting me to a party is different from asking me to come and dance in the party. Now, if Ave was on wheelchair and has been invited for this program, only to get to the entrance and she is on wheelchair and finds out that she's not able to access the building without people around, how would she feel as a person on wheelchair?
The strength of Ave, being an amputee, is not my own strength. I cannot swim. But when you ask me to sit down and write and think, I will be able to do that. The strength of a deaf man is not the same with the strength of a blind lady. So at this point, one of the strategies I have come to realize as a woman with disability is that I have come to identify my strengths and my weaknesses. So where my strength lies, I make do with it. I celebrate myself with it.
This is Against All Odds.
For many, COVID-19 and its attending lockdown remain one dreadful combo they would wish never happened again. It's the moment the economy is harsh and biting, and it is tough to put food on the table for many persons with disabilities due to high cost of foodstuff. Small businesses are crashing, and women with disabilities mainly are on the receiving end. However, for women with disabilities, the odds are much more, as they literally find themselves holding the short end of the stick as they struggle to survive in a society that gives no consideration to them. In view of this, the Executive Secretary, National Commission for Persons with Disabilities, Mr. James David Lalu, disclosed at the weekend that the Commission has commenced the process of data gathering for the 31 million Nigerians living with disabilities. Lalu revealed this during a briefing on the economic effects of post-COVID-19 on persons with disabilities in Abuja. He said the intervention of the government through the Commission is just the beginning. This is part of the promises made by President Muhammadu Buhari to lift 100 million Nigerians out of poverty in the next 10 years.
Thank you for the opportunity to be here. When I got the invitation to be here, I say I must be here personally, no more any excuse again. That is why I happen to be here. Issues of women with disabilities remain a priority for us at the National Commission for Persons with Disabilities. That is why one that is seated here has already been appointed as head of gender issues for women with disabilities in Nigeria. Dealing with that is like Akimbola, who is here with us here representing us. As we work towards budget for next year, we are going to allocate massive budgetary allocation for women with disabilities in Nigeria to be represented by our own Nike Kimbola to make sure that issues of women with disabilities is properly addressed. I was seated here, I get the opportunity to listen to some of the presentations here and the challenges that we have brought out here. Sincerely speaking, the government is not sleeping. The Minister for Humanitarian Affairs remains a very wonderful model to the disability community. Leave any other politics aside, but I want to tell you the real truth is what she is fighting internally, what she is fighting silently, is what a lot of us outside may not understand. I am a living witness right now. She is struggling for a better budgetary allocation for the National Commission for Persons with Disabilities for next year. This is something that when it comes into fruition is something that persons with disabilities in Nigeria have never seen and have never experienced.
The intervention is an empowerment program to enable members of the disability community to have a means of livelihood following the effect of the COVID-19 pandemic. The Director of Research and Planning of the Commission stated that the exercise would collate data of 1,000 PWDs from each state across the Federation and appeal to its officials to make the selection process free from interference. This, he also mentioned, that it's going to be an ongoing thing.
And we have put all the processes in place that we ensure that we collect good quality data of persons with disability for the COVID-19 intervention cash transfer. So our expectation is nothing than excellent. It's nothing than quality data. But we also expect that people in the field, in the state, should cooperate with our data collectors. Because it's not a time to start trying to change things or to reinvent the wheel. We've put all the processes in place. If they follow the instructions, definitely we get good quality data. It's a kind of harmonization between the National Commission for Persons with Disabilities and the persons with disabilities in the state at large. So if we work together as a team, we'll be able to get the result, a good result.
I think it's the responsibility of the Commission and the head of clusters in each state to try to create awareness about the data collection so that nobody is missed out. Because once a person is missed out, then it means leaving that person behind. Anything that the government is going to do needs to know that not just work on estimate, but the real situation on the ground. So therefore, I'm appealing to persons with disabilities and also their head of clusters and their organizations that let them know that this data collection is going on and therefore they should make themselves available during the data collection.
Chief Secretary, National Commission for Persons with Disabilities, Mr. James Lalu, has encouraged persons with disabilities to go out in their numbers to receive the COVID-19 vaccination, which he said is extremely important as a preventive measures against the dreaded disease that has been ravaging the world.
Today, as part of our commitment to ensure a total and committed reach out of this vaccine to the disability community, we receive our vaccine today. All the might surrounding this vaccine, we have to rope it today, because for all long, to be very sincere, I was having such fear. But today, thank God, to the National Primary Healthcare Development Agency today, they created the necessary awareness about this vaccine today, and I have received my own. I'm calling on our leaders, persons with disabilities across the country, to go and receive their own. We call on the National Primary Healthcare Development Agency to make sure that they make this vaccine available to the disability community, because the lack of this vaccine to the disability community itself is discrimination. This is what we are trying to manage today. So I call on our people that there is nothing about this vaccine. It is fine. I have received it and I am fine. That there is nothing again. So no fear it. There is no need to fear this vaccine, because we call it where we want to live. We are our population in Nigeria. We don't want to see a reduction one bit. Because as we always say, that the population of persons with disabilities in Nigeria today made us a constituency of consequences, and therefore we want to manage this. I will call, and I will still call on the disability community. As we start today, we are going to the socio-political zones in very soon, so that we will create more awareness and provide the vaccine to our community, so that we will continue to take it. Thank you to the National Primary Healthcare Development Agency for this proper awareness and making availability for the vaccine for the disability community in Nigeria. Thank you. I am fine. I'm fine.
Yeah, we hear there the Executive Secretary, Mr. James Lalu, encouraging all persons with disability to go all out there and receive their COVID-19 vaccination. Let's ignore all the myths running around. The most important thing is your safety. We understand how vulnerable persons with disability are, and it's better to be safe. It's important that we begin to use the right terminologies. Recently, DRAG organized the training for media practitioners to be able to learn the right terminologies to use and address persons with disability. We will always say, remember, it is the person first before the disability. Let us run quickly through some of these terminologies to also educate you on how to address persons with disability that live with us, amongst us, and walk with us every day of our lives. Thank you very much for staying with us on Against All Odds. Our interest is to ensure that discrimination is completely taken out of the society and thereby embracing inclusion. Let us embrace ourselves and treat persons with disability like we will treat ourselves. Thank you for staying with us on this program. We're looking forward to seeing you again, same time next week, same channel, as we bring much more to your doorstep. My name is Toshima Pius Ikerafe. To have a fantastic week. Bye.
Audio Jungle.